Which immune cells are primarily responsible for the destruction of virus-infected cells? A. B cells. B. Macrophages. C. Cytotoxic T cells. D. Helper T cells. The correct answer is C. Cytotoxic T cells directly attack and destroy cells infected with viruses, recognizing them through antigens presented on the surface. Which hormone is responsible for regulating blood glucose levels and preventing hyperglycemia? A. Glucagon. B. Insulin. C. Adrenaline. D. Cortisol. The correct answer is B. Insulin, produced by the pancreas, lowers blood glucose levels by promoting the uptake of glucose into cells and inhibiting glucose production in the liver. Which of the following diseases is caused by a deficiency of the enzyme hexosaminidase A, leading to lipid accumulation in brain cells? A. Tay-Sachs disease. B. Huntington's disease. C. Parkinson's disease. D. Alzheimer's disease. The correct answer is A. Tay-Sachs disease is a genetic disorder caused by the absence of the enzyme hexosaminidase A, leading to lipid accumulation in the brain and resulting in neurodegeneration. Which type of hypersensitivity reaction is involved in autoimmune diseases like rheumatoid arthritis? A. Type I. B. Type 2. C. Type 3. D. Type IV. The correct answer is C. Type 3 hypersensitivity reactions involve immune complexes that deposit in tissues, leading to inflammation, as seen in diseases like rheumatoid arthritis. Which of the following is a viral disease that is transmitted by mosquitoes and can lead to severe joint pain and fever? A. Dengue. B. Malaria. C. Chikungunya. D. Zika. The correct answer is C. Chikungunya is a viral disease transmitted by mosquitoes, causing fever, joint pain, and sometimes lasting arthritic symptoms. Which type of cancer is caused by uncontrolled proliferation of plasma cells in the bone marrow? A. Leukemia. B. Lymphoma. C. Myeloma. D. Carcinoma. The correct answer is C. Multiple myeloma is a cancer of plasma cells in the bone marrow, leading to abnormal production of antibodies and damage to bones and other organs. Which stage of malaria involves the release of merozoites into the bloodstream, leading to symptoms of fever and chills? A. Exoerythrocytic cycle. B. Erythrocytic cycle. C. Sporogonic cycle. D. Liver stage. The correct answer is B. The erythrocytic cycle is the stage of malaria where merozoites invade red blood cells, reproduce, and burst out, causing the characteristic symptoms of fever and chills. Which part of the immune system provides long-lasting immunity by remembering pathogens from previous infections? A. Innate immunity. B. Cell-mediated immunity. C. Humoral immunity. D. Memory cells. The correct answer is D. Memory cells, part of the adaptive immune system, remain in the body after an infection and allow for a faster and stronger response upon re-exposure to the same pathogen. Which bacteria are responsible for causing tuberculosis in humans? A. Escherichia coli. B. Mycobacterium tuberculosis. C. Streptococcus pneumoniae. D. Vibrio cholerae. The correct answer is B. Mycobacterium tuberculosis is the bacterial species that causes tuberculosis, a disease that primarily affects the lungs but can also spread to other organs. Which of the following diseases is caused by a protozoan parasite and is transmitted through the bite of the sandfly? A. Leishmaniasis. B. Filariasis. C. Schistosomiasis. D. amoebiasis. The correct answer is A. Leishmaniasis is caused by protozoan parasites of the genus Leishmania, transmitted by the bite of infected sandflies, and can affect the skin or internal organs. Which immune cells are primarily involved in the release of histamine during allergic reactions? A. Basophils and mast cells. B. Neutrophils and macrophages. C. B cells and T cells. D. Monocytes and dendritic cells. The correct answer is A. Basophils and mast cells release histamine and other inflammatory mediators in response to allergens, leading to the symptoms of allergic reactions. Which disease is characterized by a progressive loss of motor neurons leading to muscle weakness and atrophy? A. Multiple sclerosis. B. Amyotrophic lateral sclerosis. C. Guillain-Barré syndrome. D. Parkinson's disease. The correct answer is B. Amyotrophic lateral sclerosis, ALS, is a neurodegenerative disease that affects motor neurons, leading to progressive muscle weakness, paralysis, and eventual death. Which of the following is an autoimmune disorder that leads to the destruction of insulin-producing cells in the pancreas? A. Type 1 diabetes. B. Type 2 diabetes. C. Cushing's syndrome. D. Addison's disease. The correct answer is A. Type 1 diabetes is an autoimmune disorder in which the immune system attacks and destroys the beta cells of the pancreas, leading to a lack of insulin production. Which neurotransmitter is most commonly associated with the reward system in the brain and is implicated in addiction? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Norepinephrine. The correct answer is B. Dopamine is a neurotransmitter involved in the brain's reward system, and its release is linked to feelings of pleasure and reinforcement of addictive behaviors. Which class of drugs is used to suppress the immune response in patients undergoing organ transplants? A. Antibiotics. B. Immunosuppressants. C. Antihistamines. D. Antipyretics. The correct answer is B. Immunosuppressants are drugs that inhibit or suppress the immune response, preventing the rejection of transplanted organs by the recipient's immune system. Which disease involves the progressive loss of dopamine-producing neurons in the substantia nigra of the brain? A. Alzheimer's disease. B. Parkinson's disease. C. Huntington's disease. D. Multiple sclerosis. The correct answer is B. Parkinson's disease is characterized by the degeneration of dopamine-producing neurons in the substantia nigra, leading to motor symptoms such as tremors, rigidity, and bradykinesia. Which of the following viral diseases is associated with the formation of tumors and is linked to cancer development? A. HIV. B. Hepatitis B. C. Human papillomavirus, HPV. D. Influenza. The correct answer is C. Human papillomavirus, HPV, is a viral infection that can cause the formation of warts and is strongly linked to the development of cervical and other cancers. Which type of pathogen causes ringworm, a disease characterized by red, circular skin rashes? A. Bacteria. B. Fungi. C. Virus. D. Protozoa. The correct answer is B. Ringworm is a fungal infection caused by dermatophytes, which affect the skin, hair, and nails, leading to red, circular patches. Which disease is caused by mutations in the CFTR gene, leading to the production of thick mucus that obstructs airways? A. Cystic fibrosis. B. Sickle cell anemia. C. Huntington's disease. D. Hemophilia. The correct answer is A. Cystic fibrosis is a genetic disorder caused by mutations in the CFTR gene, leading to the production of thick, sticky mucus that clogs airways and causes lung infections. Which hormone, produced by the adrenal cortex, helps regulate sodium and potassium balance in the body? A. Insulin. B. Aldosterone. C. Cortisol. D. Adrenaline. The correct answer is B. Aldosterone is a hormone produced by the adrenal cortex that regulates the balance of sodium and potassium in the blood, contributing to the control of blood pressure. Which disease is caused by a deficiency of the enzyme phenylalanine hydroxylase, leading to the accumulation of phenylalanine in the body? A. Phenylketonuria. B. Maple syrup urine disease. C. Alkaptonuria. D. Gaucher's disease. The correct answer is A. Phenylketonuria, PKU, is a genetic disorder caused by a deficiency in the enzyme phenylalanine hydroxylase, leading to the accumulation of phenylalanine, which can cause intellectual disabilities if untreated.